Hello, I'm Dr. Israel Barken, the Medical Director of the Prostate Cancer Research and Education Foundation, known as PCREF. I'm going to discuss now an abstract of an article that will be discussed on Ask Dr. Barken call-in show on Tuesday evening, 6 p.m. Pacific Time, March 23rd, 2010. So let's go now to the article. The article was published in the Journal of Clinical Oncology, Volume 28, Number 9, and here is the abstract. The name of the article is Metastasis after radical prostatectomy or external beam radiotherapy for patients with clinically localized prostate cancer, a comparison of clinical cohorts adjusted for case mix. This was written by Dr. Michael Zalewski, who is a radiation oncology, and we have the whole team from Memorial Sloan Kettering here, and we also have Dr. Peter Scardino, who is a urologist. So let's go now and look at the article itself. The purpose of the article was to assess the effect of radical prostatectomy compared to external beam radiotherapy on distant metastasis rates in patients with localized prostate cancer treated either with radical prostatectomy or given external beam radiation at a single specialized cancer center, the Memorial Sloan Kettering. The materials and methods. Patients with clinical stage T1C to T3B were treated with high-intensity modulated EBRT. The dose was more than 81 gray, or with RP. They included patients that were treated after the primary treatment with salvage radiotherapy or androgen deprivation therapy for biochemical failure. Salvage therapy for patients with RP was delivered a median of 13 months after the biochemical failure compared to 69 months for radiation therapy. There was some delay in treating patients after failure of radiation of 69 months, and that's probably because of the way you define failure with PSA after surgery versus how do you define failure after radiation therapy. Distal metastasis was compared controlling for patient age, clinical stage, serum PSA, biopsy Gleason score, and year of treatment. And here are the results. The 8-year probability of freedom from metastatic progression was 97 for the RP patient and 93 patient for EBRT, for the radiation group. It's very interesting that the risk was very significant in the patients that were in the high risk. Rates of metastatic progression were similar for favorable risk disease, somewhat reduced for intermediate risk, but more subsequently reduced in unfavorable risk disease. Conclusion. Metastatic progression is infrequent in men with low-risk prostate cancer treated with either RP or radiation. RP patients with higher risk disease treated had a lower risk of metastatic progression and prostate cancer-specific death than people on radiation. The RP, the radical prostatectomy, I'll repeat, in patients with higher risk, they had lower risk of metastatic progression than patients that underwent external beam radiation therapy. This result may be confounded by difference in the use and timing of salvage therapy. It's a very interesting article, and I invite you to listen to Ask Dr. Barken call-in show on March 23rd, 6 p.m. Pacific time. But if you missed the call-in show, you could always get on our website www.pcref.org and download the show on your computer or on your iPod by going to iTunes. Thank you very much. Take care. I'm Dr. Israel Barken, the Medical Director of Prostate Cancer Research and Education Foundation, and the host of the show, Ask Dr. Barken call-in show. The phone number to call either during the show or in between the shows is 1-877-727-3301. Thank you for your attention.